Good day, everyone! This is Abayon and Lyra Hipe's poster presentation, and I'll be guiding you through a comprehensive approach to understanding, preventing, and managing a malignant wound. Thank you for joining this educational in-service on holistic assessment and management of this complex wound. Malignant wounds, often referred to as fungating wounds, occur when cancerous cells infiltrate the skin and its underlying structures. These wounds present unique challenges in terms of management and care. Let's delve into the characteristics, causes, and preventative measures. Characteristics of a malignant wounds: irregular borders, necrotic base, and ulcerative or nodular. In irregular borders, malignant wounds typically have uneven and irregular borders due to the erratic growth pattern of cancerous cells. In necrotic base, these wounds often have a necrotic or dead tissue base, which can appear black or brown and may be covered with a foul-smelling discharge. Ulcerative or nodular, malignant wounds can be either ulcerative, where the skin breaks down to form an open sore, or nodular, where raised, firm lumps develop on the skin surface. Common associated cancers. Malignant wounds are often associated with advanced stages of certain cancers, including breast cancer, melanoma, head and neck cancers. In breast cancers, these wounds frequently occur on the chest wall or in areas where breast tumors are present. In melanoma, this aggressive form of skin cancer can lead to malignant wounds, especially if it invades deeper skin layers or metastasizes. In head and neck cancers, tumors in these areas can lead to fungating wounds due to their proximity to the skin surface and the complexity of local tissue structures. The primary cause of malignant wounds is the direct invasion of cancer cells into the skin. Several factors can contribute to this process, such as cancer cell infiltration, radiation therapy, tumor proximity to the skin surface. In cancer cell infiltration, as tumors grow and metastasize, they can invade surrounding tissues, including the skin, causing destruction and breakdown. In radiation therapy, while radiation is a common treatment for cancer, it can damage healthy skin and underlying tissue, potentially leading to the development of malignant wounds. Tumor proximity to skin surface is tumor located close to the skin are more likely to penetrate and cause wounds, particularly if they grow aggressively. Preventative measures. Preventing malignant wounds involves a combination of early detection, proactive management, and maintaining skin integrity. The key strategies include early detection and treatment. Timely diagnosis and treatment of primary cancers are crucial. Regular screenings and monitoring can identify cancers at an early stage, reducing the risk of advanced disease and associated wounds. Regular monitoring. Patients with known cancer should undergo regular skin examinations to detect early signs of wound formation. Early intervention can prevent small lesions from developing into larger, more problematic wounds. Managing skin integrity. Maintaining healthy skin is essential, especially for patients undergoing cancer treatments. This can include using gentle skincare products, avoiding trauma to the skin, and implementing protective measures during radiation therapy. Timely intervention. Prompt treatment of any skin changes or early wound formation can prevent progression. This may involve topical therapies, wound care interventions, or adjustments to cancer treatments plan to minimize skin damage. In conclusion, malignant wounds are a complex and challenging aspect of cancer care, characterized by irregular borders, necrotic tissue, and ulcerative or nodular presentations. Associated with advanced cancers such as breast cancers, melanoma, and head and neck cancer, these wounds result from the direct invasion of cancer cells into the skin, exacerbated by factors like radiation therapy and tumor proximity to the skin surface. Preventative measures focus on early detection, regular monitoring, maintaining skin integrity, and timely intervention to manage and mitigate these wounds. By understanding and addressing these factors, healthcare providers can improve outcomes and quality of life for patients with malignant wounds. In question number 2, how could the wound have become infected? Now, in infection risk and transmission, malignant wounds are highly susceptible to infection due to the compromised state of the tissue and the presence of necrotic material. Understanding the risk and the mechanism of infection transmission is crucial for effective wound management. In infection susceptibility, malignant wounds are particularly vulnerable to infections for several reasons. Compromised tissue. The cancerous infiltration and associated necrosis weaken the tissue structure, making it more prone to bacterial invasion. Presence of necrotic material. Dead tissue within the wound provides an ideal environment for bacterial growth, increasing the risk of infection. Modes of infection transmission. Infection in malignant wounds can be transmitted through various routes. Direct contact. Infection can spread through direct contact with contaminated hands, medical instruments, or dressing materials. Proper aseptic techniques and hand hygiene are essential to prevent this. Airborne pathogens. Certain bacteria and fungi can be transmitted through the air, particularly in healthcare settings. Maintaining a clean and sterile environment helps minimize this risk. Contaminated medical equipment. Improperly sterilized medical instruments and devices can introduce pathogens into the wound. Strict adherence to sterilization protocols is vital to prevent this mode of transmission. Body's defenses against infection. The body employs several defense mechanisms to protect against infection. Physical barriers. Intact skin and mucous membranes act as primary barriers to pathogen entry. In the case of malignant wounds, this barrier is compromised, increasing infection risk. Immune responses. White blood cells, particularly neutrophils and macrophages, play a crucial role in identifying and eliminating pathogens. The immune system's ability to mount an effective response is essential for infection control. Localized inflammation. Inflammation at the wound site helps to isolate and combat infections. Signs of inflammation include redness, heat, swelling and pain, which are indicative of the body's response to infection. Host factors increasing infection risk. Certain host factors can exacerbate the risk of infection in malignant wounds. Immune suppression. Conditions like cancer itself, chemotherapy, or corticosteroid therapy can weaken the immune system, reducing the body's ability to fight infections. Poor nutrition. Nutritional deficiencies can impair immune functions and wound healing. Ensuring adequate nutrition is crucial for maintaining the body's defenses. Comorbid conditions. Diseases such as diabetes, peripheral vascular disease, or chronic kidney disease can impair wound healing and increase susceptibility to infections. Specimen collection for microbiological analysis. Accurate diagnosis and treatment of wound infections require microbiological analysis. Specimen collection methods include swabbing of the wound bed, biopsies, aspirating fluids. In swabbing the wound bed, swabs are taken from the wound bed to collect surface bacteria. This method is non-invasive and commonly used for initial culture and sensitivity testing. Biopsy. Tissue biopsies provide a more accurate representation of the infection by sampling deeper tissues. This method is more invasive but offers better diagnostic accuracy. Aspirating fluids. Fluids aspiration involves drawing fluid from the wound or surrounding tissue to identify pathogens. This technique is useful for detecting infections that are not apparent on the wound surface. Guiding antibiotic therapy. Microbiological analysis guides the selection of appropriate antibiotic therapy. Based on the identified pathogens and their antibiotic sensitivities, targeted treatment can be initiated, improving the chances of successful infection control. In summary, malignant wounds are highly susceptible to infection due to compromised tissue and necrotic material. Infections can be transmitted through direct contact, airborne pathogens, or contaminated medical equipment. The body's defenses include physical barriers, immune responses, and localized inflammation. Host factors such as immune suppression, poor nutrition, and comorbid conditions can increase infection risk. Accurate specimen collection and microbiological analysis are essential for guiding effective antibiotic therapy and managing infection in malignant wounds. By understanding these factors, healthcare providers can implement strategies to prevent and treat infections, promoting better outcomes for patients with malignant wounds. Talking about policies and guidelines. Adherence to policies and guidelines is crucial in preventing wound infections and ensuring optimal patient outcomes. Let's delve into the importance of these guidelines and the consequences of non-compliance. Aseptic techniques. Aseptic techniques are essential to prevent the introduction of pathogens into the wounds. This includes maintaining a sterile environment during dressing changes, using sterile gloves and instruments, and ensuring that all wound care procedures are conducted in a manner that minimizes contamination. Failure to adhere to these techniques can lead to contamination of the wound, increasing the risk of infections. Hand hygiene. Proper hand hygiene is one of the most effective ways to prevent the spread of infections. Healthcare professionals must wash their hands with soap and water or use an alcohol-based hand sanitizer before and after any contact with the wound or wound care materials. Inadequate hand hygiene can transfer pathogens from healthcare workers to patients, potentially leading to wound infections. Wound care protocols. Standardized wound care protocols ensure that best practices are consistently applied. These protocols include guidelines for wound assessment, cleaning, dressing selection, and monitoring. Deviations from established protocols can result in improper wound management, delayed healing, and increased risk of infection. National Safety and Quality Health Service Standards. The standards provide a framework for delivering safe and high-quality healthcare. Two relevant standards in the context of wound care are Standard 3, Preventing and Controlling Healthcare-Associated Infections. This standard focuses on minimizing the risk of infections associated with healthcare delivery. Key elements include implementing infection control practices such as hand hygiene, use of personal protective equipment, and aseptic techniques, regularly auditing and monitoring infection control practices to ensure compliance, providing education and training to healthcare workers on infection prevention and control. Standard 8. Recognizing and responding to acute deterioration. This standard emphasizes the importance of early identification and timely management of patients whose clinical conditions is deteriorating. In the context of wound care, this includes regular monitoring and assessment of wounds for signs of infections or deterioration, such as increased redness, swelling, warmth, pain, or purulent discharge, ensuring that appropriate and timely interventions are in place when signs of infections or deterioration are identified. Clear communication and escalation protocols to ensure that deterioration patients receive prompt and appropriate care. Consequences of non-adherence. Failure to adhere to these policies and guidelines can have serious consequences, including increased risk of wound infection leading to delayed healing, prolonged hospital stays, and potentially life-threatening complications. Higher healthcare costs due to the need of additional treatments and intervention. Negative impact on patient outcomes and satisfaction, as well as potential legal and regulatory repercussions for healthcare providers. In conclusion, strict adherence to aseptic techniques, hand hygiene, and wound care protocols in line with the NSQHS standards is essential for preventing wound infections and ensuring safe, high-quality care for patients. By following these guidelines, healthcare professionals can significantly reduce the risk of infection and improve patient outcomes. In question number 4, explain the process of cleaning and dressing your wound. Effective wound management involves several key principles: thorough cleaning, appropriate dressing, and continuous monitoring. Let's delve into each of these aspects in more detail. Wound cleansing. The first step in wound care is cleansing. This removes debris, exudate, and reduces the microbial load. Sterile saline is commonly used because it's gentle and non-cytotoxic. In some cases, antiseptic solutions like povidone iodine or chlorhexidine may be appropriate, particularly if the wound is heavily colonized with bacteria. However, these should be used cautiously as they can be harsh on healing tissues. Selection of wound care products. Choosing the right wound care products is essential for promoting healing and preventing complications. Primary dressings. These are in the direct contact with the wound bed. Alginates derived from seaweed are highly absorbent and suitable for wound with moderate to heavy exudate. Hydrocolloids, which form a gel upon contact with wound exudate, maintain a moist environment conducive to autolytic debridement and epithelialization. Secondary dressings. These provide additional protection and absorb excess exudate. Options include gauze, foam dressings, and composite dressings. Foam dressings are particularly useful for their cushioning effects and high absorbency, making them ideal for wounds with moderate to heavy exudate. Desired healing type. The goal of wound management is often to achieve moist wound healing, which promotes cell migration, reduce pain, and minimize scarring. For some malignant wounds, particularly those with a poor prognosis, the focus may shift to palliative care, aiming to manage symptoms and improve the patient's quality of life rather than complete healing. Wound tracing and clinical photography. Monitoring wound progress is critical. Wound tracing involves outlining the wound on a transparent sheet to track changes in size and shape over time. Clinical photography provides a visual record, which can be invaluable for assessing healing progress, planning treatment, and communicating with other healthcare professionals. Regular documentation helps in evaluating the effectiveness of the treatment plan and making necessary adjustments. Pain management. Comfort measures are a crucial component of wound care. Pain management strategies should be tailored to the individual's patient needs and may include topical analgesics like lidocaine gel or cream, systematic medications like NSAIDs, and non-pharmacological methods, techniques such as relaxation exercise. In conclusion, comprehensive wound management for malignant wounds involves careful selection of cleansing agents and dressings, regular monitoring, and effective pain control. By adhering to these principles, we can optimize healing and enhance the patient's quality of life. Question number 5. If your patient was to go home with their wound, what community or professional organization would assist with their dressings and wound management? Community and professional support. Once the patient is discharged, ongoing wound management support is essential to ensure continued healing and to prevent complications. Let's explore the various community and professional resources available to the patients. There is community nursing services. The community nursing services play a vital role in post-discharge wound care. These services provide patients with access to skilled nurses who can visit their homes to perform wound assessment, change dressings, and monitor for signs of infection or deterioration. Community nurses can also educate patients and their caregivers on proper wound care techniques, ensuring that patients continue to receive high-quality care outside of the hospital setting. In summary, a comprehensive network of community and professional support is essential for effective ongoing wound management after discharge. These resources provide the necessary care, education, and emotional support to help patients achieve the best possible outcomes. By leveraging this service, we can ensure the patients receive continuous, high-quality care that promotes healing and enhance their quality of life. Holistic wound assessment. A holistic wound assessment considers multiple factors beyond the wound itself. This includes the patient's overall health, nutritional status, psychological well-being, social circumstances, and pain levels. Comprehensive assessment tools and regular interdisciplinary team meetings ensure all aspects of the patient's care are addressed, promoting optimal healing and quality of life. Also, educating patients and their caregivers about wound care, the importance of nutrition, pain management strategies, and signs of complication empowers them to take an active role in the healing process. Provide them clear instructions, written materials, and demonstrating techniques can enhance understanding and compliance, leading to a better outcome. In conclusion, ensuring that all aspects of the patient's care are considered is essential for effective and compassionate wound management. And that would be the end of our presentation. We thank you.